Namaste. I am Dr. Bhumesh Kumar Katakam, pediatric dermatologist, working as a senior assistant professor in Gandhi Hospital, Medical College, Hyderabad, Telangana State. As we all know, the whole world is suffering with pandemic of COVID-19. I am going to share about COVID-19. What is COVID-19? How we are going to get this COVID-19 infection? Who are at risk groups? What are the clinical features? How we are going to diagnose? Treatment guidelines and the preventive measures. COVID-19 is a new coronavirus infection which is novel, has been transmitted from animals to human. That's why it is a zoonotic disease. Clinically manifests mild respiratory illness to severe acute respiratory syndrome. Who are at risk? It can affect all age groups irrespective of sex, but the risk is more in children's, teenage group and elderly above 65 years of age, as well as pregnant women and healthcare workers, and the people, those who are suffering with comorbidities like immunosuppressive diseases, either primary immunodeficiency syndrome or AIDS acquired immunodeficiency syndrome, those who are taking immunosuppressive drugs, those who are taking anti-cancer drugs, and those who are suffering with any respiratory illness like tuberculosis or chronic kidney diseases, hepatic diseases, uncontrolled diabetes. In this group, the chances of infection and severity is more. How we are going to get this infection? This is a zoonotic disease which has been transmitted from bats or cattle or camel to human beings. And now this COVID-19 is transmitted from human to human by either droplet infection or fomites. The droplet infection, the person who is suffering with this COVID-19, if he sneezes or coughs, the virus will spread up to 2 meters or 6 feet. Any people within the distance of that, they are vulnerable to get the infection by transmitting through nose, mouth or eyes. Or it may transmit it from fomites to human beings. If it is, the virus is liable in the air for 3 hours. So till that period, if any people take those, that may transmit. Or it may be liable on hands for 5 to 10 minutes. Or any fabrics, it may viable up to 6 hours. Whereas any metal elements, it may viable from 6 to 12 hours. Whereas a plastic, up to 72 hours, it may viable. So it may range from 5 minutes to 72 hours. And the virus, which is heat labile. If the temperature is more than 25 degrees centigrade, the virus will be killed. And what are the clinical features? It is the common respiratory illness may transmit from mild to severe to critical disease. Fortunately, 81% it presented as mild illness, 14% it present as severe illness with shortness of breath and pneumonia, and in less than 5% of individuals they presented with critical illness like severe acute respiratory syndrome. How we are going to suspect whether it is a common cold or flu or COVID-19? Clinically, still very difficult to differentiate. All features may present like fever, cold, cough, body aches, sore throat. The COVID-19, the incubation period would be from 3 days to 14 days, average of 5 days. During first 14 days, the patient is normal, will not have any clinical features, but he carries the virus. When he sneezes or coughs, he transmits the infection to others. And to suspect any common presentation would be a fever, dry cough, and throat infection with body aches. Runny nose with throat infection, the COVID-19 is unlikely. Fever, depending on the severity, if severity increases in risk groups, so the temperature will increase, a difficulty in breathing. If you have a fever, sore throat, difficulty in breathing, please consult nearby doctor for the treatment. The confirmation of the disease is microbiological. It has to be confirmed according to the guidelines by demonstration of RNA with the polymerase chain reaction. The treatment guidelines, as on today, there is, being a viral infection, there is no specific treatment, but the supportive therapy has to be given. If temperature is more, the paracetamol has to be taken, cold sponging, and plenty of oral fluids. And if the systems are involved, we have to manage according to the involvement of system, whether pneumonia is there, severe breathlessness, we have to give oxygenation. If very difficult in breathing, in very critical conditions where the patient has to be put on ventilation, any renal compromise, hepatic compromise, those all has to be managed. And as per the instruction of healthcare provider, the government of India and CDC has given guidelines. The two drugs, hydroxychloroquine and azithromycin, and antiviral therapy, according to the guidelines and instructions of the doctor, the treatment has to be given. But remember, please avoid self-medication, which will cause more harm rather than benefit to us. And vaccination. As in today, we don't have any vaccination. It will take some time, about 12 to 18 months to prepare the vaccine against coronavirus. The most important aspect is the prevention. The prevention is the best way of treatment. As we all know, prevention is better than cure. How we are going to prevent? By avoiding the contact with infected person by hygiene, that's a personal hygiene, environmental hygiene, and using of face mask, and isolation, quarantine, and boosting of immune system. Coming to the hygiene, in that hand hygiene, hand wash is most important critical step in the prevention of transmission of virus from one person to other person. The virus which remains just 5 to 10 minutes on the hands, after that it will be killed. So when you are touching any metallic items or any fabrics before going to washroom, before eating, or if you touch anything, any people, please wash your hands at least for 20 seconds. What is the rationale of 20 seconds hand wash? The virus, it has two elements. Inside there is a protein, the DNA form, and which has been covered by a fat layer. If you wash hands thoroughly, when you are washing, we are going to get that foam. If you get the foam, that means it's an alkali. The virus is in acidic form. When this foam is formed, the fat layer is broken. That exposes the genetic component of that virus, which is decayed. That is inactive. So that is a rationale of hand washing. So that's why follow namaste rather than shake hand. That's the best remedy to prevent transmission of infection from one person to another person. And environmental isolation, because the virus which is liable for 3 hours in the air, the sanitation workers has a crucial role in the environmental sanitation. And the important, the quarantine, isolation, all state governments and government of India has put on India for lockdown over a period of 3 weeks. The reason behind that, the incubation period would be 14 days. After that, you may get the clinical features. So during incubation period, the virus will multiply inside the body, but it will not produce any clinical manifestations in the individual. So that's why the person will think that he is healthy, and he will go to the community, and the chances of infection to the community is very, very high. So that is the rationale behind the lockdown for 3 weeks. By that, the best way, stay home, stay safe, and stay healthy. We must thanks to Government of India, Prime Minister Mr. Modi, and as our Chief Minister Mr. KCR for putting a lot of effort for this lockdown by involving healthcare workers, the sanitary workers, and the police department. These are the warriors along with the government. And the another important thing is we need to boost our immune system. The boosting, fortunately, the developing countries like India, we are more prone for infections rather than allergies, which are very common in developed countries. So that's why they are very vulnerable for this COVID-19. In India, the cytokines, the infective cytokines, the pro-inflammatory cytokines are more. So that's why even though our immune system is capable of managing the virus in a better way compared to developed countries. And how we are going to boost the immune system? in the pediatric age group, the immune system is premature, so that's why they are vulnerable. So always keep the children below 10 years and above 65 years the self-quarantine in the home. And above 65 years, the immune system is weak. As the age increases, our immune system would come down. So that's why even the another important thing, when the younger age group, they are going for work, especially the medical health care providers, and my request, the children and elders, keep them in a separate room. By that, we can prevent the transmission of infection for this healthcare provider to the vulnerable group. And how we are going to boost? Take healthy diet, balanced diet. The common people, they may not understand what is healthy diet or balanced diet. The balanced diet, it contains 15, 30% and 60% of fats, proteins and carbohydrates. These may not be understood by common people. To say simple word, just to follow a healthy plate. What it means? If you take a plate, 50% of the plate is filled with fruits and vegetables, and the remaining 25% should come from carbohydrates in the form of rice, chapati and pulka. And the last 25%, the proteins, they are the bodybuilders, should come from pulses, milk, meat. This is a healthy plate. This is possible if you prepare in your own in your house, that you will get the best healthy and balanced food. Unfortunately, the teenage group and the younger generation, they are very fond of junk foods like pizzas, burgers and Domino's. All that contains only junk. That will not give a balanced diet in the form of proteins, carbohydrates and fats. So in this juncture, my humble request to all the parents, please encourage your children involve in the cooking. By that, they know the importance of the homemade food which will contain the turmeric, garlic. They are all antiseptic, antiviral, which is a medical values. So this is a high time to involve your children in the kitchen for the preparation of our own food, which will definitely boost our immune system. And the second thing, take the water, protected water, 6 to 8 glasses in a day. In one word, 50 ml per kg per day. That means for any person who is 60 kgs, he has to take 3 liters of water in a day. And another important, we should do regular physical activity minimum over a period of 30 to 45 minutes. Because the tissue respiration is very important, which is possible only by regular physical activity. By that, the toxin, the waste material will be excreted from each tissue, so that acts as an antioxidant. And the lemon, citrus fruits, if you take plenty of citrus fruits, lemon, which will act as an antioxidant and boost the immune system. And keep the distance of 2 feet away from the individual. By that, even the person sneezes, so the transmitting capacity of the virus after sneezing is 2 meters. So within the distance, you keep away. And finally, just follow 20 seconds hand wash, 21 days lockdown for self-quarantine, for betterment of yourself, betterment for your family, and betterment of the nation. That is the only way we can minimize the infection in the community. Subsequently, we all are healthy. Thank you.